This is going to be amazing for frozen shoulder. I'll hop in a second. So this is going to be really good for like frozen shoulder, adhesive capsulitis, really bad rotation, a lot of tension even holding into the shoulder and neck, numbness and tingling that radiates down the arm into the hands. This is what I want to focus on. So generally, I want to look at the setup. I either want like a bolster or a pillow for her head. If she's comfortable like that, I'm great. But I want to see where I'm at. And so I know that if I try to, if I'm going to use my right elbow, so for her right shoulder, I'm going to be face to face. For her left shoulder, I would be face to feet, but you're sitting beside them. So you can just look down and you guys are technically like, it's still comfortable for the client, so it doesn't really matter. I'm going to lift her head and I just want to shift that bolster to the side so I can slip my legs in there, because a lot of people, as soon as that bolster is out, they'll think that they're impeded and they're like, oh, I can't really get in, and then their legs are like shooting out over here. So it's just a quick little shift, and you're going to do that on either side when they're in supine and prone position. So generally, I will be working on my buttocks, and I'm going to tuck myself right in, and I want to be under the backside of that scapula. And even if there's still a little gap in here, I don't want to work and see some form of like the arm raising up a little bit, because then I know that as I'm putting pressure, there's tension being pulled into the shoulder socket. So I want to make sure I'm tucked in all the way under. And sometimes the client's a little bit farther away from you, so just ask them to shift on top a little bit. So we have three main arm positions that I focus on, and that's going to be three main arm positions in supine and in prone position. Then I have two arm positions when they're in fetal position, and that is to work all around the cuff itself. So when I go to work the shoulder itself, I want to start at the top of the pectoral tissue by the clavicle. So I'm going to start at the medial border of the clavicle, working off into the top of the breast or pectoral tissue, because this is where that interior delt is inserting at the pec. And so they're going to get some tension buildup within here, and this is all around the socket. So we have the humerus in here, the head of the humerus, which comes into the socket itself. Right here we have our acromion bone. This is like a little ledge, and that kind of, I'll be working off of it and into it depending on my pivot. So it's going to be a lot of windshield wiper, and the muscles in here are coming at like an angle, gripping up. So you got to play your windshield wiper really well, and just make sure you're not flicking anything, because there's so many bands and strands, and you're going to get all these little knots built up down the way that you're going to notice that if you don't have a small pinpoint movement sometimes, you might jump over these little knots that have been created. So generally, it doesn't, if you started arms straight out, it's fine. It's just you got to remember all the steps. So I try to make sure I start directly straight down, and I want to make sure that that tissue is flush, because then I have the whole face of the belly to work. As I rotate the arm, I'm going to be starting, I'll go through the direction. So I start at the medial border of the clavicle, and I'm going to be pulling off the clavicle into the top of the breast, working my way right in this corner. We call it the smoker spot because it's the meridian for the lungs, so it might be a little bit more sensitive there. Then we want to carve over top of the shoulder socket itself, really isolating. And then, since it is a larger muscle belly, we just strip it like any muscle belly we would, and that is through the middle, the medial, and the lateral side. Once I get to about 3/4 of the way down, I want you to stop here. We're not going all the way to the elbow because we are doing elbows this afternoon. So then I'm going to, after I ran through that, that should take me about 6 minutes. I'm going to readjust her arm, and I'm lifting up, and then I place it back down. And where I push off the bicep, and I can actually feel the humerus bone right here, this is called the bicipital groove. You're going to have a lot of little bands and strands and little knots along there. And so I really want you taking your time focusing, because some of these knots can be pulling on the muscle bellies, causing it to have some of that retraction. We also have that brachial plexus in there, and that is that nerve cluster that comes down the arm. So if somebody's getting like numbing and tingling in their hands, you're going to be focusing either around C7 and trapezius area, or in this position, you're really focused around that brachial plexus. So I'm starting at the medial border of the clavicle. Once again, always start from where we begin. Work your way through the top of the breast or pectoral tissue, working to the shoulder socket, over the deltoid, playing those angles. Then I come down the bicipital groove really thoroughly to about 3/4 of the way. After I've done that, we're gonna rotate one more time, and if the client can't do it, you're not gonna do it. You're only gonna do what you can. But if they can, you're gonna take that arm, lift up, rotate back 90 degrees. And if they have really long limbs, and as I'm working, this should be fine, because I kind of will extend that leg and support it. But if I'm working and you're a smaller structure and you see this hand flopping around, just grab a bolster to tuck in and support that hand. So I want to be mindful while I'm working this medial side that all the tendons and ligaments are bared right here. They're all on the surface. So when I'm working it, I want to be pulling more vertical up through the tendons and ligaments to clean them out instead of horizontal, because that'll be like playing on guitar strings and they'll feel very weird nervy sensations coming down into their hand. So I'm still, once again, going to start at the medial border of the clavicle. Top of the breast, pectoral tissue. I can feel like her pec is actually tighter pulling in now to this section, so this will help me open up right at that anterior delt where it's inserting out as well. Then I'm coming over top and I'm going to pull more vertically up through it. And if I was left elbowed and I was face to feet, I would be pulling more vertically down. So just opposite direction. I'm going to work my way to about 3/4 of the way down. Then that's done, this whole position in supine. So I'm just going to finish off with a nice airplane landing effleurage massage, calming them down, finishing it with some love. Then we are, yes?
What is the origin, the shoulder, and insertion?
Remember yesterday we were talking about this? We have to ask the client where they feel their pain.
Okay.
So I feel like I have upper back tension and it irritates my shoulder. So we have origin, and then insertion would be cervical 7.
Okay.
And then if you're like, oh, my shoulder's irritated, and my arm goes numb, my elbow feels like it's locking up, we have origin is the shoulder, and then insertion will be the elbow. So we always stay in communication with our client. Where do you feel the origin of the pain? And then where do you feel like, if I'm putting you, and if they're like, I don't know, start putting them in an uncomfortable position, stretch the area out, and they're like limitation, they're like, I feel like kind of pulling down now. Okay, so then origin would be here, insertion's gonna be the knee. So we just have to like always ask, push their bodies a little bit, see where their limitations are, and then we make that decision.
And origin is where the pain's at in the first place.
Origin is going to be where the pain is at.
Yeah, okay.
Insertion will be the joint adjacent to it, either up or down, depending if they feel the pain go one direction.
So you would, if someone came in and said, I want a shoulder treatment, and that's what you would plan for, and then they're like, you realize that's more than that.
I have so many people come in that exact situation say, oh, I'll come in for my shoulder.
Right.
And they'll be like, oh, my upper back is so tight and this is where I feel the pain. So I'm like, okay, we're gonna do half an hour in the chair and I'm gonna focus on the one side of like doing just kind of like rector spinae muscle, trapezius muscle, teres major and minor, and then we're gonna get them down on the ground, do a little bit of whatever position they feel is the most for that shoulder, and then always focus in fetal position. Fetal position, you get the most done. But this, I kind of get the front of the socket and the back of the socket when it's supine and prone. But when they're on their side in fetal position, I cover the whole side of it and underneath it. Yeah.
When you were going around the socket, did you do the top as well, or just kind of?
So I'm not doing up here.
Okay.
I'm leaving that alone because that's too awkward for your elbow,
Yeah.
and you have no compression I'm putting into. So that's going to be getting them in the chair because that's along the trapezius muscle because it inserts near the clavicle and the spine of the scapula. Okay, so now that I've finished this area though, are we kind of comfortable with that? Okay, nice airplane landing, effleurage massage, soothing, stroking, letting them know that treatment is coming to an end in this area. Flip them over, fetal position. So she's gonna rest that arm. You're gonna look at their side first just to see, and I can see that if their side is lying flush against their body, good, go for it. But since I have that gapping, as I'm coming down this arm, I don't wanna be putting compression to where it's going to bow.
Same principle, just way back, same way.
Exact same principle. So I'm just gonna fold that towel up a little bit, place it down on the side, let that rest. So now I'm going to be working from the top of the socket, and that once again means I don't want you coming up over on top of the acromion bone. There's no compression where I'm pushing because then I'm gonna be pushing your shoulder down. So I literally just wanna start from where the acromion bone kinda ends, head of the humerus, and I'm going to, because it's a larger muscle belly now, yeah, you focus around the socket, but I'm pulling off of it. So I'm focusing the muscle belly, middle, medial, lateral, plowing your way down. And when we do muscle bellies, I do know that the kind of the shape of the deltoid is in almost like a weird little diamond. Bicep is like elongated, and then tricep breaks apart. But I'm just going to be still focusing on my middle medial lateral windshield wiper, pulling the fibers apart. Then you're going to notice a lot of times, especially with moms who carry their children a lot, or like have that purse on the shoulder for a long time, a lot of retraction of that circulation happens in this area, and so we start to get that stagnation within the muscle belly, and you get these like buildup of chunks of knots in here, and they're large. You're going to feel like you're jumping over. And that's why I say you're going to end up, like, if you're doing a lot of shoulders, you're going to feel flicking happening a lot, where you need to go pinpoint and change those angles so you feel the fibers slowly opening up to bring that healthy lymph and blood flow in.
I see that in construction workers.
Oh, yeah, cranking on those arms. See, it's anybody who does a lot with the shoulders.
Hair people that do hair, right?
Keeping it up a lot, yeah, exactly.
Tennis.
So, middle medial lateral from the end of the acromion bone, head of the humerus, and I'm going to plow my way down to about 3/4 of the way. I'm going to do that from face to face. Then I'm going to flip myself around. I'm going to tuck myself in right here on the client, and I'm going to do it again from face to feet. So, as I flip around, keep some form of connection with the client. Get yourself on the other side. And we're going to do the exact same thing, isolating the socket, and really isolate with that guide hand. Remember, if that guide hand's not there, I'm just going to fall off of it. So I'm holding myself into place, and then you're going to work through the middle, medial, and lateral, all the way to about 3/4 of the way. Are we comfortable with that part?
And this one here, you almost gotta lean over a little bit more because you can't get quite as close, right? Or can't you?
I'm right here.
Okay, piece of cake.
So if you're dealing with a client who is a little larger, you will have to get up more on your knees and lean over a little bit. Are we good with the top portion? Beautiful. So then just because there's going to be, like, I mindfully know, especially if they come in the morning, they might have a bunch of stuff to do for the rest of the day, they're gonna have a bunch of oil on their arm. So I just apply that to the side of their head because she is going to lift up and rest on her head. If they cannot do this, because this is just too much for that shoulder socket, you are going to shoot the arm out to the side. Most people, even with shoulder injuries, can at least get it to like here to let it rest, so you can still get that insertion of the rear delt. So when I'm going to begin right here, you're all good. So when I begin right here, I want us starting at that inferior tip. So I'm going to begin on the inferior tip of the scapula, and you're going to kind of be coming a little bit over the lats, a little bit on the serratus, because that's what's inserting around here. I'm working my way up once again, but it's a little smaller, but still middle, medial, lateral. As I work my way up, my focus is the insertion of that rear delt and that teres minor area, and you can feel it, like it is going to be harder on 90% of people. And so I'm focusing at the back side of that socket, and I'm just going to work my way to about 2 to 3 inches above. Don't come any higher because then you're putting compression on their head. So I'm going to work that middle, medial, lateral, opening up those fibers, playing my angles, and once again, any muscle belly, it does not matter. You can strip it down the medial, down the middle, down the lateral, or you zigzag side to side, going middle, medial, lateral, middle, medial, lateral. And I kind of just combine the two. So after I've done that, from face to feet, lightly pivoting face to side, especially when I'm in the socket, I'm going to flip myself around. Some form of connection, walk around that client, slow it down, and once again, beginning from face to face. Middle, medial, lateral, playing from the inferior tip of that scapula, working up, rear side of that delt, insertion of the shoulder socket, and I'm going to come about 2 inches above. Once I finish there, little bit of effleurage massage, letting them know that they made it through that section. And then we are going to go to the third position if we're all comfortable still. Beautiful. A lot of times, so now I'm going to remove that arm gently. Everything's nice and easy because the non-surgical work, we are going to be pushing them. It's slightly uncomfortable. We're going to get her into prone position on her stomach. Some people don't like a bolster at all and like to be just flush, or you just have smaller pillows in your practice just for them to lie on. So we're going to rotate you over, Do you want a bolster or no?
No.
No. So she
Where would
doesn't
you
like
put
it.
the bolster?
Huh?
Put large.
Hmm?
That's a big one.
Where would you put that? Under her?
No, I said a small pillow.
Okay.
I have a bed pillow that I use
Yeah.
for practice, it's perfect.
Because when you're on your back, this is easy. When you're on your stomach,
You can
this
even
is
put a
not.
little towel.
It's the same thing when we were doing the knees too. Like when I don't want to be, when I flip them over into prone, it would be weird for me to kind of get that leg inverted. So we get them on top of the bolsters.
I just use the face cradle.
That's really nice too. That works perfect. And yeah, sometimes when I'm doing the T shape and people don't like resting on the sides, you're just gonna get them slightly over to have their face around that. See, that's great too. Yeah, you can have that for your neck as well. So, I know mindfully I'm on the wrong side.
Yeah.
So, I'm gonna go and work the shoulder that I want to work. So, on the one side, I was face to face. Now, on this side, I'm gonna be face to feet, and if I was working the other shoulder, it would just be opposite. So, this is where it's still fairly straightforward, because it's the exact same thing we did on the front, but we're doing it on the back side. So I'm going to lift that arm up, and I'm going to tuck myself all the way in to the front side of that shoulder socket, so there's no compression here. I am supporting it completely. I want to begin. A lot of people will waste time, and they'll be like mid-spine. Like I'm going to be hanging out on the erector spinae muscle, and it's like, I don't want you that far over. That doesn't really consist of the shoulder. That would be more of doing like spine treatment or an upper back. I just want you on the lateral side of that scapula by like teres major and minor. And then I'm going to work my way to the back side of that socket, really focus in here, playing my angles. And then I want you working down the side of the delt and more of the tricep now, because before we got the front of the delt and the bicep. And so now we're just finishing off the arm completely. And once again, with this position, we have 3 main arm positions if the client can get into all of them. So we have 90 degrees down, and it just changes the structure of that tissue for me to get into different little angles. Then I'm going to readjust, straight out, put that down, and then once again, I'm going to be starting from that lateral side of the scapula, working through the middle, medial, and lateral, down the back of the tricep, playing my windshield wiper, really focusing on my breath, staying, playing those angles. And you're gonna have to change from like plowing to pinpoint depending on what you're feeling. If you feel like it's just a nice open soft muscle belly, great. But if you feel like there's like knots and you're jumping over too many fibers, we isolate a little bit more and you really pinch off with that guide hand and you slowly play your angles around that general area. After I've done it straight out, we're gonna do it once more, and then that's 90 degrees up. So I take, readjust, and I flatten that arm tissue. Place it, and she's kind of just holding like the back side. She doesn't need to grip me because then that might put tension, but her arm is kind of just coming around the side. And as I'm face to feet, you can slightly pivot face to side, just to get more of those angles. So don't think you're just limited to right here. I can slightly shift all the time just to get that much more of an angle.
All right, show just those 2 positions of the arm.
The arm,
Yeah,
so there's 3. So we got 90 degrees down,
right. Are you starting on that?
yep,
You're starting
Yep.
down.
straight out, and 90 up. So same thing we did on the front, we do on the back. We go down, out, up.
Provided they can.
Exactly. And then after I finish with that, we're just going to take some essential oils since it is a larger area. If people like feel like it's super achy and painful, you'll use peppermint, but Muscle Restore is normally the best one for this area as well. So you're going to take a couple drops of essential oils and finish with a nice airplane landing and Effleurage.